continue to be in daily contact with the Florida Department of Health, as well as our local health providers and health experts. Really, because truly the most important thing we do every day is about keeping our students safe. And that has really become a real challenge in so many ways, but that it continues to be a critical focus. I would argue that right now, with everything we're having to try to do to manage quarantines and isolations and things along those lines, the level of education our students are receiving is certainly not up to the level that we want. But keeping our community moving by having people in schools is such a big part of what we bring to our community, but we are just hoping that this surge can end quickly. But as a result of where we are, we have actually had to add some additional protections back in, things that we had taken away that really had less of an impact or had such a substantial logistical implication on our school that the cost benefit was being weighed. However, just because of the sheer inundation of what we're dealing with, we had to bring back every protocol that we had in place. I'm again very sorry for that. Please don't do that, please. So just a few of the things. Lunch will now be served as grab-and-go meals. Breakfast will serve as grab-and-go meals to avoid any kind of additional congregation of students and to ensure more distancing. That also opens up some of the larger areas that we have for bigger classes, collapsed classes, to have the distancing that we want. We also want, we're bringing back the one-way hallways and stairwells, which many schools are already doing, but some were not. Bringing that back. We're also holding off on any large gatherings, such as carnivals, festivals, dances. Athletic teams will no longer use the locker rooms during halftime of their games and will no longer allow for volunteers on campus during school hours. So we will be reviewing these protocols at the same time that we review our mask requirement with that opt-out option that currently is happening before September 10th. And we do hope that these additional increased measures will help alleviate some of the concerns, but we're certainly going to be going into a more expansive presentation today to go into more detail on some of the protocols with our wonderful Lauren Stillwell, who's been the lead for our pandemic. So before I do that, though, I want to acknowledge our board member, Ms. Chris Patrica, who is here. So Ms. Patrica, if you have any words that you would like to share with everyone before I hand things over to Ms. Stillwell.
Thank you, Dr. Savage. I appreciate that. And those who are familiar with my work on DAC know that I usually come before this council with a lot of energy and a lot of enthusiasm about the district. My default really is to try to find the opportunities in the challenges, but today is different. I mean, we do find ourselves in the midst of a healthcare crisis in our community. Lee Health is experiencing record numbers of patients being treated for COVID. 602 on Sunday, 625 on Monday, 636 on Tuesday, and 645 today. Of the 645, 15 are pediatric patients. 3 of them are in the ICU, and 1 of those is on a ventilator. 1 of our kiddos here in Lee County is on a ventilator because of COVID. At the height of the pandemic last year, Lee Health treated 372 patients. The increase is astronomical, and the strain that this surge is placing on our healthcare system is simply unsustainable. You'll hear from Ms. Stillwell later some district COVID data during her presentation, so I won't repeat that here. But I will tell you that during the worst week of COVID last year in the district, we received 700 COVID incident reports, or CIRs as we call them. Last Monday, August 17th, we received 700 in one day. This past Monday, the 24th, we received 1,000 CIRs in one day. The numbers don't lie. Our physicians at Lee Health don't lie. The 300 doctors that implored the school board to implement a mask mandate don't lie. The bottom line is that I don't want my own children to be one of those patients at Golisano. More importantly, I don't want any of your children to be one of those patients at Golisano. So please, I implore you to do 3 things. The first is, if your children are sick, please keep them home. The slightest cold symptom can mean COVID. And while your own child might not suffer too severely from it, your child may pass it to another child or a staff member who will suffer or die. I also implore you to please wear masks in our buildings. Please have your children do the same. Please fulfill the responsibility that goes hand in hand with our freedoms. Please. Finally, if you're mad, and I know that many of you are, and I don't blame you, please don't take it out on our teachers, support staff, or administrators in our buildings. If you're spitting mad, please direct that at me. Our employees are doing the very, very best that they can in the circumstances that they find themselves. Those are my comments. Thank you.
Thank you, Ms. Petrika. And at this time, we'll go ahead and move on to Ms. Stillwell, who'll be sharing the health and safety protocols. Also, I just wanted to introduce the staff that will be with you at each of the DAC meetings this year. And it's usually Dr. Jeff Spiro, our Chief Academic Officer, and then Linda Mayer, Executive Director for Middle Schools, and Clayton Simmons, the Executive Director for High Schools. All right, Lauren, you're up.
Okay, thanks everybody for having me. I'm really glad to be here. I'm sorry about the lighting. I was not trying to do any mood lighting. We've actually lost power at the district office, and so I am in an area where I knew I wasn't going to lose power. So as I do this presentation, I'm going to go ahead and turn my camera off so that you'll see the presentation and won't be distracted by the lighting behind me. But I just want to say thank you so much for taking the time out of your schedules to be here. As a former DAC representative for my child's elementary school, I really appreciate everything that you do to give us feedback, provide us ideas, and just the support that you have for our students and staff. It really does mean a lot to us. So with that said, I'm going to go ahead and share my screen here, and we'll go through the presentation. Well, maybe we will if I can. There we go. All righty. So our current data from the Florida Department of Health for the week ending August 19th shows a 27.9% positivity rate in our county. And as Ms. Petrika stated, we're really feeling this as a district. She gave you some numbers to put it into a little bit more perspective. Last year, and in the 4-month period between August and December of 2020, we had 10,000 COVID-19 reports filed with the district regarding exposure and positive cases. Between August 10th of this year and yesterday, we've had more than 6,000. So in 14 days, we've received more than half of what we saw in 4 months last year. So while our numbers are climbing, it begs us to repeat our primary message, which we've said all of last year and this year, and that is if a student is sick, please keep them home. See a healthcare provider for testing and care. This is really the number one way that we can prevent the spread of not just COVID, but other illnesses in our schools as well. What I'd like to start tonight with is the process that we use when we receive information about a positive case. The steps that we take, and I'll go through them individually. The first one is that the school or district COVID command center is notified, and that's mainly through what we call and what you've heard a couple of times referred to as a CIR, which is a COVID information report. There are 3 different ways that you can file this report. Actually, there's one way to file it, but there are 3 places that you can find it. The link is in 3 different spots right on the front page of our website, leeschools.net. You can see where to go by those arrows, and also where those arrows are located are all of our updated health and safety protocols. So once we actually get that report, the schools pull the seating charts and they identify the close contacts of that positive case and send the information to the COVID command center here at the district. Nurses there check that information and then send it to the Florida Department of Health in Lee County. We're incredibly lucky, I think, to have the Florida Department of Health and the collaborative relationship with their staff. Within the week, or at the beginning of next week, we should actually have the technology in place to embed their staff with our staff here in the COVID command center. That will really help us streamline communication between the 2 agencies and hopefully provide a faster response time. Once the DOH has that positive case information from us and they have the close contact list, they investigate and then they send the quarantine and isolation information back to us regarding students and employees. We then send that information to the schools and then the schools notify the families with the return dates that are provided to us by the DOH. So while on the surface, this is a very easy process, with the volume of cases and exposures we're receiving, we are behind in processing these reports. In order to fix that, we're hiring more people to help. Just this week, we trained 13 additional staff members who are going to be coming in after hours to assist. And we are going to be hiring 4 additional full-time people to work in that COVID command center. Now, under the emergency rule that was released by the State Surgeon General on August 6th, which was also updated last week, and we expect to get another update at some point this week, these are the requirements that we follow for exposures, positive cases, and symptomatic students. And it's a lot of information. This flowchart is on our website, and we will be sending it out to all families in the district tonight, along with a message about our new updated protocols. So we're going to start here with number 1, which is an exposure to a positive case. The exposure means that someone is within 6 feet of a positive case for 15 minutes or more in a 24-hour period. And the time frame is not all at once. It can be cumulative. So it could be 5 minutes here, 7 minutes there, 8 minutes there. It doesn't have to be all together. So if you move to the right on number 1, if the student is non-vaccinated, exposed, and asymptomatic, the student can return to school with a negative diagnostic test that has taken 5 days or later from the day they are exposed. So that's important because what we're seeing is that many of those CIR reports that are filed, the student is actually tested on the same day they're exposed or a day later. It has to be 5 days or more after the exposure in order to come back, okay? Another way that a non-vaccinated asymptomatic student can return is after 7 calendar days have passed since the exposure, and that means that they return on day 8. So again, calendar days, not school days. If a non-vaccinated student is symptomatic, then they must follow the protocols in Section 2 because they're considered presumptive cases. So when we move on to Section 2, that is symptomatic or COVID positive students. Under the emergency rules, symptomatic and COVID positive students are treated exactly the same. Okay, so there's not differences. There were differences last year, but this year symptomatic and positive is the same. They may return after one of 3 things happen. 1, the student receives a negative diagnostic test and is asymptomatic. 10 calendar days, have passed since the onset of symptoms. The student has had no fever for 24 hours, and the student's other symptoms are improving, all without medication. Or the student receives a note from an MD, DO, or ARNP to return to the students, and the student's symptoms are improving without medication. Those type of medical professionals are specifically written in the emergency order. So they're dictated in the State Surgeon General's rule. Then if we move to category 3, if the student has had a prior COVID-19 infection within the previous 90 days and is asymptomatic, there is no action required. The student can stay in school. But if the student is symptomatic, then the steps in Section 2 must be followed. So it kind of all reverts back to Section 2 if you're symptomatic. Finally, in the green box down at the bottom, if a student is asymptomatic and fully vaccinated, which means it's been 2 weeks since their final dose of the vaccine, they do not need to quarantine if they're exposed to a positive case. However, again, if they're symptomatic, you can repeat it with me, they follow the guidelines in step 2. So all symptoms lead back to step 2. And again, it's a lot of information to digest. We do have this flowchart on the site and we will be sending it out to families as a reference. I want to touch on the section with the orange arrow for a second. It's the little footnote and it talks about using diagnostic testing to return to school. So diagnostic testing under the State Surgeon General's emergency order, home tests are allowed. However, the home test must have emergency use authorization from or full approval by the FDA, the Food and Drug Administration. The test must be used correctly as defined by the FDA, meaning if someone is symptomatic, they can only use a test that's designated for those who are symptomatic. Finally, the results of a home test must be sent to a laboratory, done through a mobile application, or monitored by a medical provider. So if a student has a test result that shows their name and a negative status, they may send that documentation to the school in order to return. So when we have positive cases in a school, we are going to report those on our website. This is a mock-up of what that reporting tool is going to look like. We've been working on it for a couple weeks now. The table will show confirmed positive COVID-19 cases associated with our school campuses. The first section will be the daily number of cases broken down by students and employees. And the second section would be cumulative information, which will begin from the first day of school, August 10th. The information does not mean that the student or employee contracted COVID-19 at the school. It just means that they're associated with the school. The page will be updated based on confirmation of a positive case by the Florida Department of Health in Lee County. So if there's a 0, there were no positive cases reported for the school that day. We're currently authenticating the data and making some adjustments, and we do hope to have this launched on our website by the end of the week. One of the things that I do want to say is that there will be a little bit of lag in this data because while a parent will report to the school that their student is positive, the emergency rule gives labs and doctors' offices 24 hours to report it to the DOH. So we may know immediately, but the DOH may not actually get that report for 24 to 48 hours. And so there will be a little bit of a lag time when you're looking at those numbers. Also, with regards to communications, we do continue to send letters to all families at a school when a positive case is reported. That may go away once this tool is launched. We haven't decided yet, but we definitely will let you know if and when we make that decision. So one of the questions that we've gotten a lot is what happens if a student is isolated or quarantined? How do they access their lessons? So at this point, they should access their lessons using Google Classroom, and they can also email their teachers for assignments and assistance. We are offering a K-12 tutoring program called Connect with Lee. We started doing this last year and it was highly successful. Connect with Lee is staffed by teachers who offer live help and support for classroom assignments. The program is available now on school days, which are Monday through Thursday from 3:30 p.m. to 7:30 p.m. And students can access the program using the Launchpad on their Chromebooks. And we are looking to expand Connect with Lee during the daytime hours, and we're going to launch that on September 7th. So currently students can log on from 3:30 to 7:30 p.m. and get that live help and support for their classroom assignments. Turning now to our health and safety protocols. Over the summer and through the first few weeks of this year, the school district has been working internally and with our healthcare providers to research, plan, and really implement health and safety measures for our students and employees. So at the beginning of this year, we did have a number of protocols in place, including social distancing to the greatest extent possible, a mask requirement with an opt-out, desks facing forward with flexibility for grouping of students for learning, assigned seating and seating charts in order to be able to contact trace, the availability of hand sanitizer in key places in the school, and school students also are encouraged to bring their own. Teaching and reinforcement of hand washing and respiratory etiquette, limited water fountain use because we are using the water bottle filling stations, and students are encouraged as well, not only to bring hand sanitizer, but an individual water bottle to be refilled during the day. We are not allowing visitors on campus during school hours, and then isolation rooms at every school. We have those for students with COVID-like symptoms. In addition, from last year, we also continued high-frequency cleaning of common surfaces, positive case-triggered cleaning protocols, and those are followed when an individual has been diagnosed positive and has been in our vehicles or buildings within 24 hours, regular cleaning of areas where food is prepared, stored, and served, quarterly air filtration replacement, disinfection of playgrounds at the end of each day, and having students wash their hands or use hand sanitizer before and after play, and cleaning and disinfection of school buses after each run in the morning and the afternoon. As we continue to see the COVID positivity rate climb in our county, we have decided to reinstate additional health and safety protocols that were in place during the 2020-21 school year. And those, Dr. Savage mentioned some of them in his address at the beginning, include grab-and-go breakfast and lunch, staggered seating in cafeterias to avoid students sitting face-to-face, secondary classroom desks that'll be wiped down after each class change. We are holding at this time on large gatherings like carnivals, festivals, and dances. There will be no locker room usage during halftime. We are re-implementing one-way hallways and stairwells for those schools who are not currently using those protocols. Field trip and athletic travel will use an increased number of buses in order to maximize spacing. Field trips will be district sponsored only with school staff chaperoning. And adding to the visitors not being allowed on campus during school hours, we are also at this point not going to allow volunteers on campus during school hours. So all of these protocols will be reviewed at the same time we review our mask requirement with opt-out, and that's on or near September 10th. That was the date that we gave at the beginning of the year. It is truly our hope that the positivity rate will be on the downturn so that we may relax some of these protocols, but if not, they will probably remain in place. We continue to work with our partners at Lee Health, Golisano Children's Hospital, and the Florida Department of Health to provide COVID-19 testing and vaccine to students and employees. We are hosting the mobile vaccine clinic at our schools. In fact, we have 4 upcoming opportunities where community members and staff and students can be vaccinated on our campuses. And we plan to start COVID-19 testing in the schools again with the Florida Department of Health for students and employees either later this week or at the beginning of next week. And I have gotten a couple questions about that, and I do believe that they will be the rapid tests, which we were offering at the end of last year. So it will be the rapid testing that the DOH will come to our campuses and provide the opportunity for our students and employees. Again, these are completely optional. In every case, a parent or guardian must be present for a student to receive either a test and or the vaccine. And as we mentioned at the beginning of the presentation, we are operating a district COVID-19 command center. This is for parents and employees who have questions about our protocols and processes. The center itself is open on school days, Monday through Friday from 8 a.m. to 4:30 p.m. And the phone number is 239-356-2800. And as I did mention, we are hiring additional staff to work the command center to provide more timely response to calls and reports that are filed. And I just want to say that on the call with us tonight is Vicki Otto, and she has been part of this COVID command center since last year and does an inordinate amount of work in order to keep things moving with our schools and our families. And so big thanks to her, because I know there have been many days where she's been working 14 to 16-hour days trying to help us catch up and create better processes in order to be more responsive to our community. Please know, hold on, I'm going to come back on camera a little bit here. Please know that we really care deeply for your students and our employees. We understand that many of our families are increasingly scared for our children in the midst of the tumultuous time. And I hope that the information that we're presenting and the additional measures help ease some of that concern. But I just want you to know that we're not going to stop looking for ways to try to make our safety processes better and to do everything we possibly can for our students and staff in the building, not only health and safety wise, but educationally wise. And finally, we are going to do, I believe we're doing, and Erica and Shanna can correct me if I'm wrong, the breakout rooms. And so the question that we really have for you in the breakout rooms when we're discussing all of this is, in relation to COVID, how can we better communicate and provide support to our parents, students, and staff when quarantined?
All right, thank you, Ms. Stillwell, for the presentation and lots of very important information that you shared with us. We will get to the breakout rooms in just a few minutes, and if we could have the facilitators of each breakout room make sure they capture this guiding question, so when we get there, we can move into that discussion. Mr. Hertz, our DAC chair, is going to join us later. And so therefore we have our vice chair, Mr. Ken Wolbert, and he is going to take us through the approval of the DAC minutes from April 28th, and then also our public comment time. And we can make a decision now whether we want to do that now or after the breakout rooms. Mr. Wolbert, that will be up to you. How would you like to proceed?
Yeah, we'll go ahead and proceed with that now.
Okay.
Just a quick reminder to everybody, please sign in using the chat box by entering your school name if you haven't done so yet. And at this time, I'll take a motion to approve the minutes from the DAC meeting on 4/28/21. Very short minutes, so I'll look for a motion to approve those minutes.
I'll do the motion to approve.
Motion by Ms. Robinson. Need a second?
I'll second.
Second by Justine Shaw. Thank you. And then at this time, we'll accept any public comment from non-DAC members. All right, looks like there's no public comment, Ms. Grimm. So this time Ms. Grimm will put us into our breakout rooms. Remember the question that was posed. Let's make these during these breakouts. Let's not take this to an argument type session where we're going to discuss or debate the protocols and such, but how we can help our students and staff better navigate through this time. So at that point, Ms. Grimm, whenever you're ready, we'll go to breakouts.
All right, I will start those now. Miss Patrica, where do you want to start? Do you want to start off with elementary, middle, or high?
Elementary, please.
Brent, would you like elementary, middle, or high?
Elementary.
Amanda Purcell, elementary, middle, or high?
Elementary.
Angela Myers. Anna.
Elementary, please.
Ann M.T.
Middle.
April.
Elementary.
Charles Morris, elementary. Dane,
Elementary.
thank you. Dane Kelly. David. Deshonda.
High school, please. Thank you.
You're welcome. Debbie Peterson. Martha Domansky. Martha. Regina.
High school, please.
Jen. Teresa Lee.
High school.
Megan Harris. Morgan.
Yeah, so we can start with elementary if you want to start with your breakout report. Ms. Robinson, you're muted.
Yes, I am. Thank you very much. So we talked about for a long time what processes are and how those look and where breakdowns might be kind of in all factors, because even with the Department of Education and the Department of Health, anything breaking down in red tape there ultimately filters down to the parents. So we discussed about the potential of streamlining the Department of Health and Department of Education's spreadsheets on how they correlate the information, that hopefully if we can smooth that process out and marry those quicker versus maybe waiting for interviews and so forth that seem to be incredibly backlogged and potentially not happening, that we can get out information quicker to the schools and to the students and parents and so forth. We also talked about utilizing more of Peach Jar, Facebook, for the school's individual Facebooks, and sending home paper forms with protocols on what to do and how to do it. Also, specifically, we talked about how it should go out ad nauseum, the information on what the help center can help with, because there are likely, or potentially, maybe potentially is a better word here, potentially issues with people filling out paperwork. And that is really where a lot of it starts. So if parents don't know how to fill out paperwork, can't access the paperwork, don't know where to find the paperwork, the COVID Center can help walk them through that, and we can get that process started. But if they don't know that that source is there for them, then that it's not being utilized to its full benefit. So getting that into parents' hands, again, Peach Jar, Facebook, paper form, however, and as often as possible, reminders, because people may not remember, 2 weeks ago when it didn't matter, but it may happen to matter now. So repeating that communications and providing the flow chart on what to do if you do test positive would be very beneficial to just keep repeating that information. Ms. Fletcher, do you have any other things that I know I'm missing? I know I'm missing some.
No, I really think that you hit everything. We did have a discussion about how to make sure, because the protocols are changing, the health protocols are changing often. And so when we share that out, how we can make sure we are communicating with a date stamp that is like flashing so that they make sure people are making sure they're referring to the latest. But I think you did great, Chelsea. Thank you.
Thank you. And I did remember one thing that I forgot was some teachers are unsure of the status of their students. So to not forget to communicate with them on why if the student is going to be out because of a COVID exposure, and it may be a long period of time, versus, just a day or two for a cold, would be beneficial on the teachers' end.
Thank you, Ms. Robinson. We'll move to our middle school group.
I can report on this one. In regards to the question, we mostly talked about the use of Google Classroom for students who are being quarantined, and we had a question about reinstating Zoom or any other type of not Google, through Google, I can't remember what it's called, but just a way for students who are home to connect with teachers. And Ms. Duncan did let us know that there isn't anything in place right now for doing any kind of Zoom sessions with teachers, but that reminded us that there is the Connect with Lee after hours. And like you guys told us in the presentation, as well as the one that's going to be launched in September for daytime. And I'm just going to piggyback here off of elementary school for a second and add to our conversation on that I do think even that would be a really good thing to continue communication with and repeat communication to parents, because like the elementary group stated, we don't always pay attention to things if they're not affecting us at the moment. And so once they do, and you have a child that's quarantined, then it's kind of a nice reminder. So we did talk about more ways to get that out to parents, and perhaps using Parent Link to communicate with parents and send reminders that we do have that Connect with Lee after hours right now, just as a secondary place to go outside of Google Classroom for their children's assignments, or if they need help with things. And even though I was aware of it, I wasn't aware of all of the things that go along with that. So it actually sounds really neat. And there is the connection on Launchpad for students, along with times and different subject areas and things that the students can connect with. And there are teachers that are waiting there, and it sounds like they're getting some one-on-one help there if they're not getting assignments. One of the questions that kind of went along with the Google Classroom is that some families are not necessarily seeing full lessons that are included in Google Classroom, which is difficult sometimes to provide. And so that Connect with Lee would be a good place to go. We also talked about that there are some interactive agendas that are being worked on to be placed out there for families and students that are quarantined. And then we did go a little off topic for a couple little things that Ms. Duncan and Ms. Meyer and board member Patrika were very good at answering, I think. And I think that was it for our group. Did I miss anything? Okay.
Great job, Justine.
Thank you very much. And last but not least, our high school group.
Hey, it's Amy Jane McWilliam with the high school group. We really focused on the academic side of supporting students during their quarantine, and also when they return to school, to make sure that they're on target, that they're meeting their due dates, and they're understood what they missed. So first we looked at, we wanted to verify if they have internet access, right? And if they don't, perhaps we can talk about the hot spots again, and how to make sure that kids have that internet connection while they're at home, or else they can't do anything. They can't access the Connect with Lee or anything. Second, we're going to go over Google Classroom. Some teachers are making actually a calendar, which has hyperlinks to recordings of the instruction for the day, along with assignment links. Another teacher didn't use a calendar, but actually had a Google Doc that they had available to their students, and it lists all the things right in one place, so they don't have to keep going back and forth to each day, that it's in a very convenient place for them, so they don't miss that. The other thing we're going to look at is Connect with Lee. Make sure that the student knows that they have access to this in the daytime and in the evening. But what we do understand is that not all students are comfortable with meeting online with a strange teacher, and maybe they have more of a relationship with the teacher that they have. So we'd like to the district to consider some teachers using like their planning periods to connect with their students, or provide an additional like Zoom class for students that are at home. We understand that there's an MOU and there's teacher contracts and all of that. So we understand that that's not a simple thing to do and implement. Also communicating with parents about all the resources that are available to their student while they're at home, and making sure that the parent realizes that they need to be really on top of their student, even if they aren't normally during the year, to make sure that their child stays on track. And this might be text and emails, and also using the student messenger tool for teachers to connect with both the student and the parents. Then when the students return to school, teachers should meet with the students, or guidance counselors should meet with the students to see where they're at. Do they make up all the assignments? Were they able to handle this and work with the Lee, Connect with Lee during this time? Or are they way behind, especially for the students who are at risk to begin with? And, you know, again, we have a lot of students out and this is going to take some time, but it's important to make sure that the school is aware of a child falling behind, so that these aren't the kids who are going to ask for extra help on their own. So instead of waiting until the end of the school year, and personally, I have an example of that where, you know, we almost didn't graduate 8th grade because we were so far behind from quarantining. So really, it's not just what we're doing and the support that we provide the students and the parents during quarantine, but also making sure that we're meeting with the students once they return to school and making sure that they're on target and they're meeting all their assignments. They have the time that they need to complete the assignments, which may go surpass the district's current policy of however many days they were out plus 1 day. And that's basically what we talked about.
Thank you, Ms. McWilliam.
You're welcome.
At this time, I'll open it up for any more public comment from non-DAC members. All right. I just want to go and just thank Ms. Otto, Ms. Stillwell, Ms. Duncan, and Ms. Vitale for their time and this pretty much impossible job they are undertaking right now for this school year. And we really appreciate all the hard work you're putting into keeping our students safe and still getting a good quality education while you're at it. So I certainly appreciate that. But at this time, I'll motion for good of the order.
This is Dr. Kapadia.
Yes.
My name is Shyam Kapadia. I'm one of the ICU doctors for Lee Health System. And I was invited on this call. I'm not really sure why, but it was a very interesting call. And I really appreciate everything that you guys are doing. As a physician in critical care, I've seen some of the worst things I've seen in the last 3 to 4 weeks in the hospital. The increase in parents that are struggling with the illness, having their children be sick from COVID-19 has taken a toll on all of us in the health system. The admissions to Golisano have increased. They have started surge capacity bedding, meaning they have opened up pediatric ICUs. And what I ask this group is for leading by example. Teachers should wear masks. I've heard that many teachers aren't wearing masks, and you are ultimately the teachers of all of our students. Also, I think mask mandates are very important. Masks have shown to decrease transmission. And I think waiting till September 10th to talk about mask requirements is going to lead to increased mortality in the children that we are taking care of. And I think that is inappropriate to wait till September 10th to have the conversation again. And last but not least, I wholeheartedly want you guys to teach the future generations the importance of hand hygiene, masking, and how important it is for vaccination. Because all of the people that I've seen in the hospital have been unvaccinated. The ones that don't survive are the ones that didn't get the vaccine, and unfortunately they are regretting it. Thank you for giving me some time to join you guys. I know you guys have a tough job. We all do together. And I really appreciate everything that you guys are doing for my children and the children of Lee County.
Thank you very much, Dr. Kapadia. Any other speakers' comments? All right, this time we'll motion for the good of the order.
I'll motion.
Motion approved by Chelsea Robinson. Did I get a second?
I'll second it.
Second by Mr. John Shannon. With that being said, our next DAC meeting is September 29th. Same time, 6 o'clock. Look for the agenda to come out and the invite to come out in your emails. With that being said, I'll motion to adjourn the meeting.
And before you do that, this is Chris Patrica. Yeah, I just want to thank you for corralling all of us tonight in your debut as the DAC chair and really, you did a fantastic job. On short notice, you managed us well. So thank you, sir.
Thank you, Ms. Patrica. Appreciate it. All right. And then I'll motion for adjournment.
I'll motion.
And I'll second it.
Motion by Chelsea Robinson, second by Ms. McWilliam. Thank you, everybody, for your time, and we'll see you on September 29th.
Take care.
Thank you.